Hello! Didn't see you there.
Over here.
Oh, hey! You're in for a treat today, because today I'm going to read you a story about the superficial anterior muscles of the human body. We'll start with the iliopsoas.
Where's it at?
Oh, I'm glad you asked. It's found in the ilium and lumbar vertebrae, and while I'm at it, it's found in the lesser trochanter of the femur. Its main action is to flex the hip.
That's fascinating. Tell me more.
Next, we have the adductor muscles. Where are they found, you asked? In the pelvis. Their insertion point is the proximal femur, and their job is to adduct the thigh. Next, we have the tibialis anterior, found on the proximal tibia. Its point of insertion is the first cuneiform and the first metatarsal on the foot. Its main action is to dorsiflex and invert the foot.
Continue story time.
I'm glad you're as enthused about learning as I am. Next, we have the serratorius. It's found in the ilium, and its insertion point is the proximal tibia. Its job is to flex the thigh on the knee. Oh, and up next we have the quadriceps group. There are vast locations for this, but they're mainly found in the femur. The tibial tuberosity and the patellar ligament are the insertion points, and its main actions are to extend the knee and next we have the extensor digitorum longus, found in the proximal tibia and the radius. Its insertion point is the distal toes, numbers 2 through 5. Its job is to extend the toe and dorsiflex the foot. And next, we have the fibularis muscles. They're found in the fibula. Their insertion point are the metatarsals of the foot, and their primary action is to plantar flex and evert the foot.
Because of contract disputes, I am now the orator of this special. And I'm here to tell you all about the neck, trunk, and shoulder muscles. First off, I'll start with the trapezius. The origin is the occipital bone in all cervical and thoracic vertebrae. The insertion is in the scapular spine and clavicle, and the primary actions are to extend the neck and adduct the scapula.
Is that all?
I'm glad you asked, and the answer is no. I'm also here to talk about the latissimus dorsi, located in the lower spine and iliac crest, insertion at the proximal humerus, and the primary actions are to extend and adduct the humerus.
Wow, how swell!
Oh, you haven't seen anything yet. On to the deltoid muscle, located in the scapular spine and clavicle with an insertion point in the humerus, specifically the deltoid tuberosity, and the primary actions to abduct the humerus.
Wow, where else are muscles located?
Well, just about everywhere, but I'm going to talk about the ones in the arm and forearm, like the triceps brachii, located in the shoulder girdle and proximal humerus, with an insertion point of the olecranon process of ulna, which allows it to extend the elbow. Next, how about the flexor carpi radialis, located in the distal humerus, with the insertion point of the second and third metacarpals, which allows you to flex your wrist and abduct your hand. Flexor carpi ulnaris? Yes, please. With an origin of the distal humerus and posterior ulna, the insertion of carpals of wrist and fifth metacarpal, and the primary actions being flexing your wrist and abducting your hand again. And I'm just getting started. The erector spinae is our next topic, with an origin of the iliac crest, ribs 3 through 12, and vertebrae. Insertion, ribs, thoracic, and cervical vertebrae, and the primary actions are to extend the back. After that, let's just go ahead and talk about the quadratus lumborum. The origin there being the iliac crest and lumbar fascia. Insertion, transverse processes of upper lumbar vertebrae with the primary action of flexing the spine laterally and extending the spine. Where would we be without it?
Hey, we're back with the last leg of the Christmas special. I'm going to be talking to you about the flexor digitorum superficials. The origin is the distal humerus, ulna, and radius. The insertion is the distal phalanges of the second to fifth fingers. The primary actions is the extend fingers and next we have the extensor carpi radials. The origin is the humerus, and the insertion is the base of the second and third metacarpals. Their primary action is that it extends the wrists and abducts hands. Now, we have the extensor digitorum. The origin is the distal humerus, and the insertion is the distal phalanges of the second to fifth fingers. The primary action extends fingers and wrists. Then, we have the gluteus maximus of the hip, thigh, and leg muscles. The origin of the gluteus maximus is the sacrum and ilium. The insertion is the proximal femur gluteal tuberosity. The primary action is that it extends hip when forceful extension is required. Then, on to the gluteus medius. The origin of the gluteus medius is the ilium. The insertion is the proximal femur. And its primary action is that it abducts thigh and steadies pelvis during walking. Next, on to the hamstring muscles. The origin of those is the ischial tuberosity. Their insertion is proximal tibia, head of the fibula in case of biceps femoris. The primary actions are flex knee and extend hip. On to the gastrocnemius. The origin of the gastrocnemius is the distal femur. Its insertion is calcaneus or heel via calcanea tendon. The primary action of this is the plantar flexes foot and flexes knee. Now, last but not least, we have the soleus. The origin of the soleus is the proximal tibia and fibula. The insertion is the calcaneus, and the primary action is plantar flexus foot. And that's all for our hip, thigh, and leg muscles.
The arm and shoulder muscles. The biceps brachii. Its origin is the scapula of the shoulder girdle. Its insertion is the proximal radius, and its primary actions is that it flexes the elbow and supinates the forearm. Brachialis. Its origin is the distal humerus. Insertion is the proximal ulna, and the primary action is that it flexes the elbow. Now on with the trunk muscles. The pectoralis major, found near the sternum, clavicle, and first to sixth ribs. Its insertion is the proximal humerus, and its primary actions are adducts and flexes the humerus. The rectus abdominis. Its origin is in the pubis. Its insertion is sternum and 5th to 7th ribs. And its primary action is it flexes the vertebral column. External oblique. Its origin is the lower 8 ribs. Insertion is the iliac crest, and its primary action is it flexes and rotates the vertebral column. The deltoid. Its origin is the scapular spine and clavicle. Its insertion is the humerus, or deltoid tuberosity, and its primary action is that it abducts the humerus.
Now onto the head and neck muscles. First we have the frontalis. It's found in the cranial aponeurosis, and its insertion is the skin of the eyebrows. An example of this is raising your eyebrows. Next we have the orbicularis oculi. It's found in the frontal bone and maxilla. Its insertion is tissue around the eyes, and an example of this is blinking or closing your eyes. Next we have the vicularis oris. It's found in the mandible and maxilla. Its insertion is the skin and muscle around the mouth, and an example of this is closing and protruding your lips. Next we have the temporalis, which is found in the temporal bone. Its insertion is the mandible, and the primary action is closing your jaw. Next we have the zygomaticus, which is found in the zygomatic bone, and its insertion is the skin and muscles at the corner of the lips. An example of this is raising the corner of your mouth. Next we have the masseter. It's found in the temporal bone. Its insertion is the mandible, and an example of this is closing your jaw. Next we have the buccinator. It's found in the maxilla and mandible near the molars. Its insertion point is the orbicular oris, and an example of this is compression of cheeks, as in whistling or sucking or holding food between teeth during chewing. Then we have the sternocleidomastoid, which is found in the sternum and clavicle. Its insertion is the temporal bone or mastoid process, and an example of this is flexing the neck or rotating the head. Lastly, we have the plastema. It's found in the connective tissue covering of the superior chest muscles. Its insertion is tissue around the mouth, and an example of this is pulling the corners of your mouth inferiorly.
That concludes our Christmas special. Have a very Merry Christmas, everybody, and a happy, happy New Year.